So, without further ado, I would like to introduce our next speaker, who is Mimi Narayan, and I want to give you a little bit of her background. So she's done lots and lots of work, and actually I've known Mimi for quite a while because through EDRA, so we knew each other there first. But Mimi is a principal associate at the Health Impact Project, which is a collaboration with the Robert Wood Johnson Foundation and the Pew Charitable Trust. The goal of the National Health Impact Project is to reduce health inequities and improve the health of all people by ensuring that health is a valued consideration as public policy. Dr. Narayan is directing the project's strategic initiative that assesses the relationship of climate change and health, and specifically tribal health. The relevant nature of Mimi's work and its potential impact on communities has attracted national and international interest and recognition. And I've seen a lot of Mimi's work, and I've been very impressed. And I think it has a lot of potential for relevance for the work that everybody here does. So I'd like to give a hand to Mimi. Welcome her up.
I wanted to start with a short public service announcement. I am under the weather slightly, so if I'm coughing, please close your ears. I will try to move the mic away. I don't want to blow your eardrums out. But with that, I'm going to start with a story. So thank you, first of all, Jeremy, for the introduction, and I really appreciate everybody being here and for inviting me to speak. When I was a health impact assessment practitioner in Phoenix, Arizona, I was asked to do a health impact assessment on a historic public housing redevelopment. So as any architect or planner does, the first thing I proposed was a site visit. So I go on this site, and I'm walking the site, and I notice broken sidewalks, I notice some potholes on the street, I notice brown lawns that clearly were once green. But as I keep walking on this site, I get this absolutely putrid smell of trash. There's dead animals, mice, rats, maybe even dogs. And then this deafening noise, and it's a constant. White noise from traffic on a freeway nearby. There's this sputtering and hissing of these 18-wheelers that are clearly braking and going and braking and going on this freeway. And then something even louder. I can't even hear myself as the jets fly right above my head, low to the ground as they're landing on the airport, right next to this housing, pretty much. There's, of course, rust stains on the walls of the exterior of these houses. There are entranceways that have unscreened screen doors. And there's cracks all along the foundations. And yet, at our first workshop and meeting at this community, 100 of the residents came and said, yes, we want to stay. Yes, we want this site redeveloped. This is our home. That's a story of place attachment. City officials came to this meeting and were completely befuddled. Why? Why do you want to stay here? There's nothing here. And the residents explained that their children were born here. Some of them had had their first dates in the park on this site. Some of them had said their last goodbyes to beloved grandparents. This was home, and this is where they would stay. Was this place making them sick? Oh, indeed. but they still wanted to stay. Can't move that freeway, but they still wanted to stay. So what do you do with places like that? What do you do with places that are old places, as Jeremy said, that have significance, that have deep connections and tell the stories of the interaction between the people and the places over time, but they are really not affording health for the people that are there? So that's what I'm going to talk about today, but I'm going to talk first a little bit about what is the health impact assessment as a tool. So, as Jeremy kindly said, I work for the Health Impact Project, and we are a collaboration of the Robert Johnson Foundation and the Pew Charitable Trust, with the goal of lifting up health as central to decision making at the state, local, federal, regional level in all decision making. We work across sectors of education, transportation, housing, community development, criminal justice, you name it, wherever decisions are made. My background is an architect. I'm an architect and a planner by training. And then somewhere along the way, as I was starting my doctoral work, I got very excited about environmental design and sort of found my way working at the intersection of health and the built environment, and here I am, having worked on that exact topic for the last 15 years. So at the Health Impact Project, we do a lot of things. We do place-based grant making, but more than just place-based grant making that supports more health impact assessments across the country, we also do a lot of research and evaluation of said health impact assessments to see if they have any effect or if they really support the health of the communities in which we're doing those. We also scale our work to change the way that organizations, specifically large organizations, do business in order to integrate health and health equity into decision making. And we work on emerging strategies that Jeremy alluded to, such as right now, the work we're doing addresses climate change and health, as well as tribal health in the country. So I keep saying health. And no, I'm not just talking about diabetes numbers or heart disease factors. When I'm talking about health, we see health with the broader definition of health as the World Health Organization defines it. And it really is about all of the social, economic, and physical environment that affords both our health behaviors, but also affects our health. I love this slide because it's always amazing to me that 88% of money is spent on medical services, meaning healthcare, and yet we do so little to support the environment, which is a primary driver of health, and change that environment in order to support health. The other piece that I want to talk about that was in sort of our mission statement is equity. We, of course, specifically deal with health equity, but when we talk about equity, I want to make a clear distinction between equality and equity. Equality is about everyone having the same resources to succeed. But equity is really about everyone having what they need in order to succeed. And that's very different because we know that systems and policies and programs affect different populations differently. And so you will see as I go through the study of that public housing, how different policies have affected that population differently, and that's why they are where they are today. So the one tool that we have in our toolbox in order to integrate this health, if you will, into decision-making processes is a health impact assessment. And what is that? Well, it's basically a very structured, systematic approach of assessing sort of baseline conditions of a community, for example, if you're talking about redevelopment, and then understanding what the impact will be if a proposal, whether it's a redevelopment, whether it's a program, a change, or a policy change, goes into effect. I'm sorry, didn't mean to do that. And then we develop recommendations in order to mitigate negative health effects from that proposal and support positive health as an outcome of that, whatever the intervention may be, whether it's a change in policy, a program, or a project. Sorry, that keeps going there. And then hopefully we can track and monitor and evaluate what that did to the health of that community. That map is really just a snapshot of the over 400 now health impact assessments that have been done in this country on various decision points, just to give you an idea of where it's being done. There are several in Maryland. Unfortunately, most of them are located in the Baltimore area, and a few that are outside of that. But across the country, there have been many, and across many, many sectors. As you can see, a large majority of them have been done on the built environment and at a local level, so decisions at the local level. However, we continue to work on federal level decisions and state level as well. So, to give you a continuation of the story that I started with, the public housing I was talking about is the Coalfield-Lamoureux Public Housing in Phoenix, Arizona. It's located in South Phoenix, which is where I was prior to coming to the DC area. As you can see from those statistics, it's quite a neglected, geographically isolated community. It's basically this site right here, which was built in 1954 in order to house families of Vietnam veterans that, when people had gone to war for the Vietnam War. And it was supposed to provide them an environment of comfort, connection, and prosperity. By 1968, this freeway had been developed. The two arterial streets that you see there already existed, but had been paved over time and gotten busier and busier by the time this freeway came around. So the freeway and those arterial streets nicely cocooned this public housing into a little corner, if you will. A school was developed by 1985 just south of the community in order to support. By 1985, it had become a public housing site, so to support the children that were in that community. And then by the 1990s, all of that shaded area that you're seeing right now became light industrial. So I don't know about prosperity or connection or health of that community. 709 residents, out of which 58% were children, 412 or something were children. So we're talking about under the age of 18. And as you can see, household, the median income being significantly lower than the county, the state, and of course the country. To top that, they have one grocery store nearby. Of course, there was no economic development happening here because there was nothing, to draw economic development. So this one grocery store, can anybody guess what the primary product sale is? Yeah, alcohol. Yeah, alcohol primary sale. And then the second is packaged food, meaning snacks that are incredibly unhealthy. There was produce, but it's produce that certainly none of us here would consider produce. Most of it rotten because there was no proper facilitation of refrigeration, and folks just did not know how to keep that up. The closest grocery store is yes, excellent, 10 points. Walmart, 2.3 miles away. This community is predominantly made up of non-car owners, car sharers. So can you imagine walking 2.3 and 2.3 back with groceries? So some more images of what it looked like on site. These are the nicer images. And the park right there, we're talking, the park right there is unshaded, and we are talking 120 degrees in Phoenix in the summer when the kids are home and on vacation. Vacation meaning staying home. So that's state of the housing. But that's not enough, right? Because it's also right next to that freeway, so it's within, well, more than 50% of the site is within the air pollution zone from I-17, and the school is 118 meters away from the center of that freeway, with several other hazardous material and waste sources around, such as a water recycling plant, such as a landfill, and several other large industrial sites to the north. And those jets I was talking about, that's the airport map, and that's where the site is. Not quite in the mitigation zone, so FAA didn't need to do anything about it, per se. But loud enough that there is an impact. So what do we do with that? That's all baseline conditions, as we call it in the health impact assessment. So what do we do with that? So now there's a decision, right? The decision was, we'll redevelop, but redevelopment means so many things. There's all kinds of design decisions that go into redevelopment. So what you do with a health impact assessment is take the baseline conditions and then look at every decision that needs to be made through the lens of what the literature might say, how that would impact the health of the community. And when I say health, I mean those social determinants of health. Access to healthy foods, access to safe housing, access to transportation, access to a safe environment, safe streets, social cohesion. How are those affected based on the literature, based on data analysis that we did, which is just number crunching, and then the stakeholder input. So a big component of health impact assessment in order to afford equity is to include stakeholders in the decision-making process. So we did this with all of the stakeholders at the table. So residents, the industrial site, owners of the businesses, other local business owners, and anybody that had stake in this community, other community-based organizations around the city, the county. And then we assess what the likelihood is of that impact happening and what populations will be affected by that impact. And we do that through sort of looking at the rigor of the literature, the rigor of the stakeholder input, and the rigor of the data analysis. So it's a very sort of scientific-driven process, but with a mixed method approach. What that means is that when we then get to recommendations, we can say this as academics, what does that mean to the residents? Because we are including them in the decision-making process. So we create visuals, give them an idea of what does this look like. We came up in this case with 61 recommendations that were very technical at points. So we came up with design prototypes to say this is what it might look like. That has two purposes. One is to allow residents to both understand the data and the implication of what the change might be and advocate for. And then two, to allow residents as well as other stakeholders to be part of the decision-making process, to provide input that is most prioritized by them. Here's another snapshot of prototypes that we drew up for what it looks like. Everybody is visual. That's what I've learned. We redeveloped and redesigned the park. Initially, the developer wanted to just replace the play equipment, but it's still going to be 120 degrees in Arizona. That's not going away. So we redesigned it, and it was accepted with lots of push from the community itself, which was great. And as I said, we took equity into account. So both in the process and in the recommendations that we developed. So we did provide residents with knowledge. That's the first step of equity, because partly you can be left out of decisions if you don't understand what decisions are being made about you. So we also created a facilitated sort of a bi-directional learning platform. So we included residents in our steering committee and called them our local experts. And they sat down with the environmental assessment expert and talked about technical things at a layman level, if you will. And then we also provided recommendations. Off those 61 recommendations, several of them were about continuing sort of measures to ensure equity in future decision-making processes, including creating a leadership program for residents, creating a community council, because those who can have voice can only have a voice if they're invited to the table. And so we challenged them to be at the table. So what happened? I know everybody's anxious to hear. What happened? What happened was that this site, first of all, used the National Historic Tax Credit as part of the funding, lever, and was designated on the National Historic Registry for public housing. But basically, overall, the project received $44 million. This is from an actual website that published the story based on the recommendations that were adopted by the developer. And out of the 61 recommendations, not all of them were to the developer. Some of them were to the developer because as the architect, I had to translate this into design terms. And then some of them were to the city, some of them were to the county. And we had an unprecedented cooperation between city and county, which had never happened in Phoenix before. Why? Because residents took those findings that we showed them and the knowledge that we imparted to them about their own health and went to leadership, to their local representatives, and advocated for themselves. And were able to move political will in a way that really afforded this to happen. Suddenly everybody wanted to be part of it. From the local council member to the county commissioner, everybody was excited. And some were up for re-election, so that helped. There we go, our local council member. Came to the inauguration of this, one of the intersections where there was no crosswalk. By the way, that school, there was no crosswalk to get from one part of the neighborhood to the other, so kids would run across the street. And during our study, 2 children, 8 and 10, were killed crossing them during our study. And still, we had to, push, if you will, to get the city to do a pedestrian study on that intersection. But yes, this is the hawk light that was put in. If you know what a hawk light is, it's an activated crossing light by pedestrians. And then the park just got completed in April of this year, and has most of the features other than the water feature. Received a lot of funding from several private entities such as Lowe's and Home Depot and other folks, which, by the way, residents advocated for. This is the new housing, very close to the prototype that we were able to build for them. This is the community center. Initially, when the park design was being redeveloped or was being thought of, as I said, the developer really wanted to replace the play equipment and just wanted to put fresh paint in the clubhouse. But this was the historic heart. This was going to be the place for social cohesion, because what I didn't tell you is that we looked at all of those health parameters. The biggest one that came up as a priority for residents was social cohesion, because there was such a lack of social cohesion in that community of just 700 people, because there was no place to be. There was no place to be. The park was not a place you could be, given Arizona's heat. And there was no lighting, it was hard for people to walk outside, people were scared. And yet, this community center at the park is the driver for this community to be able to come together. We created an artifact of identity. So this was designed by residents, with residents. And they created a beautiful mural with an artist and a sculpture because they had lost their sense of identity. This became one of the main features of the park because they wanted to be able to tell the stories, those stories that made the history of this place. Other health outcomes, like I said, social cohesion, but we also realized that the sense of self-efficacy. We proposed a community garden in the park, which right now is being built. And there were at least 50 master gardeners living in this community. And they felt like they had purpose again. Older, gentlemen and women that really felt like, oh, I can go out and do something in my community. And this is something we gathered from case studies that we did after the health impact assessment was done, just to understand what did it do for people. Now, did it change their cardiovascular numbers and diabetes rates? I'm not sure. It certainly changed something about their asthma rates. The kids in this community, as I said, 412 kids, had an asthma rate of 51%, as compared to 7.5 at the town. So it did change some in terms of respiratory illness, but we're still tracking those. This has just been completed. Some other examples quickly to show you how a health impact assessment fits into sort of this preservation work and why it would benefit to have health impact assessments as part of preservation work. This is one of my favorite examples. This is a Quitman light rail station that was a transit-oriented development in Houston, Texas. The development of this light rail station was proposed, and the folks that were doing the health impact assessment actually wanted to do it in this neighborhood because Preservation Texas had named this neighborhood one of the most endangered places. I've never heard of a place being endangered until I saw this health impact assessment, but I'm not a preservationist myself, so maybe y'all have better familiarity with that term. But what they did is engage the community in this light rail redevelopment or this light rail station installation. And when they did, the first thing that came out was, we are an old community, and we have been here for years. We're a Hispanic community, but our voices and our traditions have never been lifted up. And so the recommendation by the Health Impact Assessment was to create a historic and art-based council to support that gap. And a local artist joined this, who's also a resident, by the way, of this neighborhood, heard of this, and basically engaged the community in coming up with a design that would facilitate at least a place for that. So the design reflects a lot of the important people, quotes, places that that are part of this neighborhood. A second quick example might sound familiar if you know about Standing Rock. Does anybody not know about Standing Rock? So this is a CO2 pipeline, slightly different, that was proposed in Albuquerque in 2015 by Kinder Morgan to run through Torrance County. This is, and I'm going to have to refer to my notes because I don't remember the number of sites that were there, but it is a historic places. There's already several places that are part of the National Historic Register. So dating back to the 17th century, it includes the 3 sites of the Salinas Pueblo Mission National Monument. And it would run through those sites, including 12 other, both historically and culturally significant sites of the population that lived in this county. Health impact assessment was done. It literally revealed one of the outcomes that came out was that this project, if it were to go forward, would trigger historic trauma. I'm sure everybody's familiar with historic trauma, or what that is. So it would trigger historic trauma as one component, which means severe psychological and mental health effects on the population of this county. And because while Kinder Morgan has not actually acknowledged that, but while the results of the health impact assessment were coming out, Kinder Morgan withdrew their proposal. A project on the horizon that I would want to leave with you as I am concluding is a project we are very excited about at the Health Impact Assessment. Health Impact Project, which is a health impact assessment that is being done by the city of Natchez, Mississippi, if anybody's familiar with where that is. Has tremendous history, both with positive and negative affect, depending on who you ask. But it is certainly rich with history. And the city of Natchez, I want to say, along with the Mississippi State Department of Health, is conducting this health impact assessment in order to understand how the register designation, sorry, I'm going to have to refer to my notes because I'm not familiar with the terms. Register designation will affect the health of this community. And by health, I mean they're looking at social cohesion, they're looking at community context, safety, economic development, workforce development, tourism. And this project is something that we have just funded, so they're just starting out. It's very exciting, and keep looking out for that. It's going to be completed potentially by the end of 2019. The health impact assessment will be. And then recommendations will be given both to the city of Natchez, but also to the preservation entity in Natchez, Mississippi. A quick note, I know you're wondering why is there NEPA here, but a quick note on NEPA, because the National Environmental Protection Act, National Environmental Policy Act, is something that is triggered by many of the projects that we work on, policies that we work on, as is the same for you. So I don't know if you have heard, but yesterday we received some word that there is a potential for a reform. Since 1968, there hasn't been any reform of NEPA. There's a potential reform that is going to be put forth by this administration, and that there will be a public comment period opening. Now, if you're aware of the executive order that came out last year in 2017, right after the administration change on streamlining NEPA, I think there are specific implications for that to what this means when the public comment period comes out, either early next week. It was supposed to come out either today or early next week. I'm not exactly sure when it will come out, but this is what we heard from CEQ. But we have been working for a long time to integrate health and health impact assessments into NEPA processes, particularly in order to mitigate some of the litigations that have come up on the back end for environmental review processes, because their consideration of health is so narrow. And so we've been working with our friends at the EPA to try to get that moved forward. I don't know if this is an opportunity to make that happen through this reform process, or if that's sort of putting this on the back burner. But I guess we'll find out. But I just wanted to make folks aware in case this affects your work, which I believe it does. And finally, I know I'm the only thing standing between your Friday evening drink. So I'm going to make this quick. A quick call to action. What you do is preserve the history of places, the stories of the places, and the interaction of people and place. And what we do is try to make places healthy. Why should these be on opposite ends of each other? How can we work together to make sure that the places in which the histories are made, good or bad, and the stories are told, are also places that are healthy for the people that live in? That's my call to action. Thank you so much for having me.